Every 45 minutes in the UK, one man dies from prostate cancer. It's one of the most common forms of cancer in men, with over 52,000 cases diagnosed annually. Yet, despite these sobering statistics, it remains one of the least understood cancers among the general public. Let's start with the basics. What exactly is the prostate? The prostate is a walnut-sized gland located just below the bladder in men. Its primary function is to help produce semen. Surprisingly, nearly 3/4 of men surveyed don't know what the prostate does, and almost half don't know where it's located in their body. Prostate cancer occurs when cells in the prostate gland start to grow uncontrollably. What makes this cancer particularly challenging is that early-stage prostate cancer, the most treatable kind, often shows no symptoms whatsoever. This is why understanding your risk factors and getting appropriate testing is so crucial. So, who's at risk? There are several key factors that increase your likelihood of developing prostate cancer. First, age is a significant factor. The risk increases substantially from age 50 onwards. Second, race plays a role. Black men have double the risk of developing prostate cancer compared to other ethnicities and are advised to begin screenings at age 45. Third, family history matters. If your father or brother has had prostate cancer, your risk doubles. And this risk is even higher if they were diagnosed at a younger age. It's vital to be very clear about your family history with your doctor. There are more than 20 genetic mutations that can increase your chances of developing prostate cancer, including the BRCA gene mutation that's often associated with breast cancer. What many people don't realize is that early prostate cancer typically doesn't cause symptoms. Only 1/3 of men are aware of this critical fact. By the time symptoms do appear, the cancer may have already advanced. If symptoms do emerge in later stages, they might include blood in urine or semen difficulty urinating and unexplained weight loss. However, it's important to note that urinary symptoms are more commonly caused by non-cancerous conditions like an enlarged prostate, especially if the cancer hasn't grown near the urethra. Detection typically begins with a PSA blood test, which measures the level of prostate-specific antigen in your blood. This might be followed by an MRI scan and possibly a biopsy. For men under 50 without risk factors, testing isn't routinely offered on the NHS, but you can request a PSA test from your GP if you have concerns. Exciting developments are happening in prostate cancer screening. A new mass trial called Transform, funded by Prostate Cancer UK, is being billed as the biggest advancement in prostate cancer diagnosis in 20 years. This trial combines various screening methods, including high-speed MRI scans, blood tests, and genetic testing, with the ambitious goal of reducing deaths from prostate cancer by 40%. Recent research has shown that MRI tests can catch twice as many cases of prostate cancer as standard blood tests. If you're diagnosed with prostate cancer, what happens next? The answer isn't always straightforward. Not all prostate cancers are the same. Some grow very slowly and may never cause problems during a man's lifetime. For low-risk, slow-growing cancers, doctors often recommend active surveillance rather than immediate treatment. This involves regular monitoring through blood tests, MRI scans, and possibly biopsies to check for any changes. A major study called the PROTECT trial followed over 1,600 men for 15 years and found that active monitoring had the same high survival rates as radiotherapy or surgery for localized prostate cancer. Unlike many other cancers, a diagnosis of prostate cancer should not be a cause for panic or rushed decision-making. Patients and clinicians should take their time to weigh up the benefits and possible harms of different treatments. For cancers that require intervention, traditional options include surgery to remove the prostate, known as prostatectomy radiotherapy, and hormone therapy. Newer, less invasive treatments include cryotherapy, using extreme cold to destroy cancer cells and high-intensity focused ultrasound, or high-FU. However, these newer approaches don't yet have the long-term research behind them that traditional treatments do. Medical science continues to advance in the fight against prostate cancer. Here are some of the most promising developments. Immunotherapy, which harnesses the body's own immune system to fight cancer, has been successful in treating other cancers and is an active area of research for prostate cancer. In April 2024, a drug called olaparib was approved for men with advanced prostate cancer. This precision medicine works by blocking proteins that cancer cells need to grow and survive, potentially extending lives by 6 to 18 months. Perhaps most futuristic is the application of artificial intelligence. AI systems are being developed to analyze prostate cancer scans and predict which patients will benefit from specific treatments, potentially sparing thousands of men from unnecessary hormone therapy and its side effects. An important aspect of prostate cancer treatment is balancing effectiveness with quality of life. Treatments like surgery, radiotherapy, and hormone therapy can cause significant side effects, including urinary incontinence, erectile dysfunction, weight gain, cognitive changes, fatigue, and depression. For some men, these may be temporary, but for others, they could last a lifetime. This is why the medical community is increasingly focused on providing just enough treatment to control the cancer, and no more than necessary. Living with prostate cancer, particularly under active surveillance, can take a psychological toll. The anxiety of knowing you have cancer, even if it's slow-growing, can be significant. It's important for men to seek support for the emotional aspects of their diagnosis, whether through professional counseling, support groups, or open conversations with loved ones. Mental well-being is a crucial part of the overall cancer journey. The future looks promising for prostate cancer detection and treatment. With advanced screening techniques, precision medicines, and AI-assisted diagnostics, we're moving toward a time when more men can be diagnosed earlier and receive treatments tailored to their specific cancer. The conflict remains between curing the disease and maintaining quality of life. As Dr. Matthew Hobbs, Director of Research at Prostate Cancer UK, puts it, we need to use new treatments to reduce the number of men dying, but we also need to reduce the number of men suffering by having just enough treatment to control their cancer, and no more than that. Prostate cancer affects 1 in 8 men in their lifetime. It's a significant health challenge, but with increasing awareness, better screening, and advancing treatments, the outlook continues to improve. Remember these key takeaways. Know your risk factors, especially if you're over 50, of Black ethnicity, or have a family history. Understand that early prostate cancer often has no symptoms. Discuss testing options with your doctor based on your personal risk profile. If diagnosed, take time to understand all your treatment options. Consider both effectiveness and quality of life when making treatment decisions. For more information on prostate cancer, visit Prostate Cancer UK's website or speak with your healthcare provider. Don't let embarrassment or fear prevent you from getting checked. It could save your life.